Hi, everyone, and welcome to the Muslim Sex Podcast. Thank you so much for tuning in. I really appreciate your patronage, and I would love it if you could leave me a 5-star review because that really helps me. And if you could like and share this episode with somebody that you know that may benefit, your friend, your colleague, anyone, I'd really love you to share this podcast, especially if you find value in the Muslim Sex Podcast. Also, I'd love for you to subscribe to my YouTube channel and follow me on all my social media. Also, as you probably know, if you've been listening to this podcast, is that I have a practice that is now open in Chappaqua, New York. I see patients for menopause and sexual health, as well as regular gynecology. So if you are looking for a gynecologist that actually spends time with you, that has time to listen to you, then I would invite you to come and see me in my practice, and I'd be more than happy to take care of you. So make sure if you live in the New York area, or even if you don't, come and see me in my office. I'd love to meet you. And also, last but not least, is that I am hosting again my retreat in Morocco for 2025. So if you are looking for a gift for a family member, a friend, yourself, make sure you take a look at our retreat, the Love and Nourish Retreat. It will be held September 19th through the 26th, 2025. Again, this year in Morocco, we will be visiting the same towns. We will be in Marrakesh and Essaouira. And as always, we will be providing information and lectures on menopause, perimenopause, nutrition, and also going for cooking classes as well as excursions. So don't miss out. I know a lot of people were sad when they missed out this past year on the Morocco retreat. So make sure that you go and visit the Love and Nourish Retreat hosted by Caria Retreats. And now onto the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about the interplay of aging and intimacy with fertility. Now, before I get into it, the first thing I want to make very clear is we are definitely not giving any type of medical advice. So if you have any questions about fertility, please speak with your friendly neighborhood reproductive endocrinologist. And if you have any questions about your religion, please speak with your friendly neighborhood religious leader. And this is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. Okay, so I am super excited to have on with me during this podcast, Dr. Famuyiwa. And Dr. Famuyiwa, please feel free to introduce yourself to all the guests and the listeners out there.
Thank you. Thank you so much for welcoming me. My name is Dr. Oluyemisi Famuyiwa. I am the founder and CEO of Montgomery Fertility Center. I'm also an assistant professor of obstetrics at gynecology at GW Medical School, and the recent founder of a podcast called Fertile Talks. So I've been a little busy.
Oh, fantastic. Wow. I love that title, Fertile Talks. That's fantastic. Oh, well, congratulations. You know, it's always fun starting a new podcast.
Absolutely.
So that's excellent. So yeah, well, let's get into it. So let's talk a little bit about aging and the interplay of aging and intimacy and fertility. So what is it that you see when patients come to you? You know, I know that when patients are, well, when they come to you, they are definitely very stressed out. And they're
Yes.
very anxious, and they really, really, really want a baby really badly. So what do you notice?
So I think that we have some of my patients two very separate issues that can be very stressful. One is a lot of my patients who are getting older that they don't realize that they're running out of options for fertility. So they're running out of time. And also, not just running out of time, but looking at issues with intimacy that can be a problem for some patients. I recently have difficulties with patients. I see patients who may have issues with trying to be intimate with their partner so they're not sexually active. If you're not sexually active, there's no way you're going to get pregnant, right? So that can be a problem with some of our patients.
Yeah,
Yeah.
absolutely. So, I definitely know and understand that when, patients want a baby so badly, they become very tunnel visioned. And I think that also what happens is that the intimacy, the emotional intimacy between the two partners really starts to, I want to say, I don't know, fall apart, right? Because I feel that, sex becomes a chore. And anytime something is a chore, then it's not really enjoyable anymore. Everything is timed, everything is
Exactly.
scheduled.
Yeah,
And so it becomes really difficult for the partners.
absolutely. Like I have case in point, I have a patient who she and her husband have never had any intercourse for over 22 years. They just
Oh
haven't.
my God. Wow.
So there are clearly intimacy issues where we need a sex therapist involved,
Yeah,
aside from the medical part of it.
sure.
And then patients putting off trying to conceive um, to such a long extent that aging becomes a big issue. Um, it's very difficult for patients to get pregnant around age 40 something. Um, that could be a problem in
Yeah.
terms of how long do they put off their fertility, and then all of a sudden, like this other patient called me and said, well, I need to get pregnant like yesterday. I'm like, well, you haven't had intercourse. No, I need to get pregnant right this second,
Oh,
right this minute.
wow.
Like, oh my gosh. So there's a lot of issues there that we have.
Yeah.
Yeah.
I am, I have to kind of take you back a little bit. I'm so concerned about this patient. Like, so they've never had sexual intercourse for 22 years.
Yes.
How old were they when they got together? I mean, were they like 12?
They were in their mid 30s. They were in their mid 30s, and then they kept putting it off and procrastinating. And then all of a sudden, we're now 41, 42, and you want to get pregnant. So now I have to backstep a little bit here. It's okay. You've never had intercourse before. You don't live in the same country.
Oh my God.
How's this going to work?
Good
Well,
luck.
I like do some IVF, do something, make it happen, but it needs to happen right now. So, yeah, that's where we are. So there are a lot of issues there from, I think in this case, not just sex therapy, but maybe marriage counseling. And now, if they had seen me 10 years ago, we would be dealing with younger eggs and maybe younger sperm. Compound with this problem is the fact that we now have eggs that are getting older, right? The
Mm-hmm.
eggs are not as efficient. So, how am I going to pull off this miracle when the eggs are now getting older and the sperm is now getting older? And my mandate is to produce a baby immediately.
Wow, that is crazy. Well, there's so much there that I'm just so confused by this whole scenario. So,
Exactly.
so they're not even in the same country. So is he gonna like transport the sperm to you? Like, I'm just confused. Like, what's gonna happen there?
No, she wants to come down and she'll spend a limited amount of time, and I'm supposed to make this magic work in that limited amount of time, and
Wow.
then she's gonna hop off. And I'm like, okay, where do I start unpacking this?
Yeah.
Where do I start fixing this? Because, like you said, on so many levels, we have
Yes.
different issues.
Yeah.
Um, do we start with a therapist first? Do we start with a marriage counselor first? But they both sound like this was made total sense to them, like they wanted this, right? So I'm
That's crazy.
I just I think part of the issue may be that they just never had intercourse, and it may be cultural in the sense that I don't even think they know what to do. Right. So there can be some societies where there's such a negative um
Sex negativity. Yeah.
Yeah, there's a very negative connotation to sex activity, such that some people may grow up thinking, well, I should never, ever, ever have sex, right? And
Yes.
then all of a sudden they get to an age now, the parents who've already infused into them that sex is all bad come back and say, well, where's the baby?
Yeah.
Right? Whereas the message should have been there's nothing wrong with sex with the right person at the right time in the right relationship, right? So, I'm almost having to play therapist there, and that's not my role, right? I would send them more to someone like you to say, help me sort this out.
The whole thing is crazy. Okay. So I have to say that, okay, first of all, like, why are they even married? I mean, it seems like they're living in different countries. I wonder if it's just because it was convenient, maybe, who knows, and it seems like they're kind of living their own lives. And now they want to come together and have this kid. And they want you to make it happen, which I think is fantastic. I mean, I guess they should call you the miracle worker. I mean, gosh, this is
Right.
this is
Right.
crazy. And
Yeah.
then I wonder, so what I always say is that whatever's going on in the bedroom is also going on outside of the bedroom. So I wonder, are they even communicating with each other? I wonder, I'm just so curious about this whole case. Like, I wonder if, do they even talk? I mean, I wonder what their conversation was
It
like,
sounds
like,
like they do talk, but it may not be in depth.
yeah,
Like, how you can have conversation
yeah,
around
yeah,
the issue.
yeah.
I had another patient that had an arranged marriage,
Hmm.
and then the husband got sick. So
Hmm.
now she went into this deep spin about how her whole life revolves around taking care of him, but he's now fine. But she's very, very bitter and angry with her parents. So now the reason her life cannot progress is because she's been forced into this role and yada, yada, yada. And the parents are going, well, if you don't want it, then get out.
Yeah.
But she's not getting out. What she's doing is talking around different issues. And um, that's another one that we have a loaded um, social circumstance
Yeah.
compounding medical fertility, right?
Wow.
So where do you tease that apart, right? And I try to get them to see the psychiatrist who comes from their same cultural background so that that person may understand the nuances of their culture, which is where I think they need to start. But this roundabout argument has been going on for so long that I don't know if you've observed it, how some people they talk themselves into a position and then they lock in.
Hmm.
And it's hard to, well, for me, again, that's not my field. So I have to rely on a therapist or a psychiatrist or someone who can now go through counseling sessions with them to figure out the root causes. Because I can't I can't do magic in the fertility field if we have all these deep social, psychological issues that are unresolved. We need to resolve that before we can move on to the medical part, right?
Yeah, it seems like you've got a lot of issues with a lot of patients.
Yes.
I don't know. I mean, I feel like you almost need to be a psychiatrist, huh? At the same time that you're this fertility doc. A
Oh
lot
man,
of patients seem to have a lot of deep-seated issues that
there are
need
a
to be
lot of
resolved.
issues.
Yeah.
Yes. And that's why in the field of fertility, like if you, a lot of the things I've written out in my blogs and I put out in my podcast is we really need to get to the cultural root
Yeah.
of some of these problems before we can even help these patients, right?
Absolutely.
And if we just focus on, come on, we need to check your ovaries, we need to check your eggs, we need to check the sperm, bada bing, bada boom, and you make it transactional, there's a lot that's lost in translation, and these patients end up suffering. In my view. So I'm supposed to all of a sudden stimulate this patient, get eggs, fertilize with sperm, put it back, and I have a time frame which I'm supposed to accomplish this. Never mind that your menstrual cycle may not fit whatever time frame you prescribed. And then what about, like you said, the other issues going on? So what's going to happen with the pregnancy? What's going to happen with the baby? What's going to happen on their emotional end, right? And can we sort this out? Um, and in the meantime, we're running up against the fact that, yes, their eggs are getting older. So it's not like they have a lot of time.
Yeah.
But so, yes, those are some of the complex issues that we need to unravel very patiently, right? You can't rush it. Unravel it patiently before we can move ahead.
Yeah, I just, it seems like there's so many things going on in both of those relationships that,
Yes.
I'm just curious to know if they think that, sometimes I think when partners are in really dysfunctional relationships, they think that having a baby is going to solve all their problems,
Uh-huh.
and most of the time it doesn't. It just makes them worse because now there's a third person,
Mhm.
and so it seems like all of these people really need to figure out these things before they even come to you, right? So I
Abs-
wonder how this, how the interplay of aging and intimacy comes into play. Do you think that because people are older, that they feel that there's such a time crunch that it affects their intimacy more than, say, perhaps somebody that would be younger coming to you? What do you think?
No, no, I don't think so necessarily, because, like you said, they have relationship issues that need to be addressed.
Yeah.
I'll give you another instance. I had a young couple. They came from one of the Muslim countries in Africa. This was many moons ago, and the patient was a virgin, and she had vaginismus, and they had never
Mhm.
had intimacy,
Yeah.
and they were young. And so we did uh, several therapy sessions where I talked to them about, making sure that she sees her husband as a safe figure in her life, as
Right.
a friend,
Right.
as on her side, and train her brain to see that. And forget about the sex first. Just let's work on what your husband means to you. And then I asked him if you could be patient while she sorts this out in her head. So once she can see, oh, husband, safe, husband, friend, then she's open to being close to you. And don't worry about the sex part. Worry about just being intimate in terms of just holding hands, being friends. Because when you build that solidly, the sex part comes later. And that's what we did for like a year. And they came back to me, and they have the best relationship ever, got pregnant on their own. But but they were young, we had time, and they were patient with each other, they were willing to work with each other, they were listening to each other. So they had probably a very good, intimate, not sexual, intimate relationship. So if you don't have that intimacy, again, not sexual intimacy, intimacy of being friends, of being comfortable in in each other's presence, of trusting each other that this person has your best interest at heart. If you don't have that, it sex is not going to bring it. Sex is going to make it worse.
100%. Yeah, no, I mean, I think that, I always talk about, there's so many different types of intimacy, right? Not, it's not just physical, but there's emotional, intellectual,
Right.
experiential, different types of intimacy. And absolutely, women tend to, and, not just women, I'm sure a lot of people do, but, women have a tendency to crave that emotional intimacy where they can become vulnerable with their partners. And when they have that emotional intimacy where they feel safe, right? Where they feel that they have a relationship with this person, then they become open to sexual stimuli and then open to the physical intimacy. But you're
Exactly.
right. A lot of times, you have to work through it. And especially for people that have never had sex before, have never been in a relationship. And then
Yes.
all of a sudden, like we talked about a little bit earlier, that they were raised in a community or, somewhere where they felt like sex was wrong, dirty, shameful their whole life. And then all of a sudden they get married and now they're expected to produce a child. Well, you can't go from, this sex negativity to all of a sudden, becoming this sex fiend when you've never been taught, or you don't understand, or you don't even know your own anatomy, right? You have to give yourself time, and you have to give yourself space, and be patient with yourself and with your partner, and then go to a place of at least sex neutrality, so that then eventually you become sex positive. But I don't know. I mean, some people never get to that point of sex positivity, but they have to at least become sex neutral, so that they can be and are able to be willing to respond to a sexual stimuli, right? But if they never get to that point, then, that's where you have a lot of people with unconsummated marriages. You have vaginismus, and then those women that have vaginismus, their partners have erectile dysfunction, their partners have premature ejaculation, because, they're just not able to meet,
Yes.
and or even able to understand one another, or even understand their own bodily functions, right?
Yes. Yes. So, you know, and it all boils down to, are you in a committed, safe relationship? Because if you now strive to bring a child into a relationship that's not safe or committed, they just compound the problems.
Yeah. Yeah, absolutely.
And we can't even, like I said, we can't even get to the fertility workup part when we have this huge elephant in the room that we haven't sorted out,
Yeah.
right? So it's easier to do when my patients are younger, because some of these things take time. It took me a year with a younger couple.
Yeah.
Now, when you have someone who's 43, 44, they don't have a year to
Right.
sort out.
Mhm.
That's where the problem comes.
Yeah.
Now I'm having to explain the age and effect on eggs,
Yeah.
and I'm having to explain the age and effects on sperm. Like, men think the sperm doesn't get old. It does get old, right? And then you put aged eggs with aged sperm, it's harder to achieve a normal euploid healthy baby.
Right, right. And that, I think you bring up a very good point. I think that, a lot of times the idea is that men have forever, right? That their sperm are good forever, and that, it doesn't matter. They can have babies at any age, whereas women have almost like an expiration date in terms of their fertility. And that's
Yes.
really not the case. And I'm glad you bring that up, because, it's really helpful for both, people in that relationship to really understand what's going on in their fertility journey, and, how it's because I believe that oftentimes women tend to be the ones to bear the responsibility of whether or not, they get pregnant, and whether or not they actually end up conceiving. And we know that I think it's like 50% of the time it's male factor
Hmm.
infertility,
Absolutely.
and it's not just female,
Yeah.
due to the female factor. So, really important to understand all of this. And, when I was in residency, and I actually, when I was in residency, I was thinking about doing reproductive endocrinology and infertility. And I remember shadowing this doctor,
Yeah.
who was my mentor at the time, for a few months. And I was just worn out. So I have to hand it to you. It was so mentally draining
It
to,
is. It,
like, be with people that, and you want to help them so badly, right? But it just is exhausting, because these people, all of these individuals want a baby so badly, and you want to be the one to help them, but it just doesn't always work. And it's, like you said, there's so many other issues that come about. And especially if people are coming to you when they're in their 40s, mid 40s, it's so much harder to get them to, conceive a baby than it would have been at 20, right? Even though
exactly.
20 people can have unexplained infertility. And I
Yeah.
saw that in the infertility office. But then, like you said, you have the benefit of time on your side. Whereas when you're, in your 40s, mid 40s, you just don't have that luxury anymore.
That's right. Absolutely.
Yeah.
So one of the things I like to do is put out information, helping people digest this information, because they just don't know. And hopefully be able to catch their attention while they're still in their 30s, enough for them to say, okay, we need to work on our relationship before we get to 43, 44, 45. You need to figure out that relationship. before we get to that age, and now it's
Yeah.
harder. I mean, we can still work with you in that age. It's just harder.
Right.
And it's, and sometimes, it may be that those patients may end up needing donor eggs because there's not much that can be done for their eggs when we wait that late, right?
Yeah.
Yes, science is coming up, research is coming up in terms of trying to reverse some markers of aging in the ovary and in the eggs, but that's still in the research phase. We're not
Right.
full blown saying, yes, we have the magic formula and we're going to dial back the time on your eggs. It kind of doesn't work that way.
Yeah, yeah, definitely. You're absolutely right there. I'm curious, so everybody, a lot of people that have problems conceiving, often look to women in the public eye that have children when they're much older, right?
Right.
Like we saw that with Janet Jackson, right?
Exactly.
Didn't she get pregnant at like 52? I don't know.
Yes. I have yeah,
Yeah.
50 or,
And it
yeah.
was it was with an Arab prince, right?
Yes,
And
correct.
it's
Absolutely.
so I'm so curious about that. Like, I wonder, I mean, I can't imagine they were her own eggs. I mean, who knows? She may have even been menopausal at that point. So,
Yeah.
I'm
Yeah.
wondering, I wonder if it was, it was probably donor egg, you would think. No, I mean, a 52.
I'm not sure I know the specifics of her case, but maybe she froze her eggs when she was much younger and
Yeah,
came
that's
to use
true.
it, or maybe she used donor egg. Another thing that people need to be aware of is there are some markers of aging in your uterus as well, right?
Mm,
So implantation is not always um, easy when you're over 50. Now, I know different areas have different age cutoffs. It used to be in the past, like I work in the state of Maryland, and we would have patients who would use donor eggs and try to conceive at 55, 56, many, many years ago.
wow.
Now, that age has decreased to 52,
Oh,
right? So, and I tell my patients that, and even so, that's the cutoff age right now here, because most high risk pregnancy physicians, MFM, perinatologists, they don't want to be caring for you when you're over 52, right? So
yeah.
you're going to have a hard time finding a doctor to go to for obstetrical care. And the reason being, if you're in your 50s, pregnancy is harder, as you know, it's harder on the body,
Yeah.
right? It's taxing on the body. So there's that element of risk as well. So I let my patients know who are freezing their eggs in their, 30s, some in their early 20s. Um, you know, have a mind to when you think you might use it. Um, I'm not so sure you'll be able to use those eggs when you're 55. I mean, you can, you just have to go get a surrogate in some instances. So those are all the planning things that patients need to sort of have well thought out.
Absolutely. That's a good point you bring up about, those eggs being frozen, because sometimes even those frozen eggs, though, right? Sometimes they don't always take, and sometimes the
Oh,
embryo doesn't
absolutely.
always form.
Yes.
So even if a person, had the foresight to know that, what, I'm
Yes.
going to freeze my eggs, I'm young now, and I don't know when
Mhm.
I'm going to get married and have children, blah, blah. So I'll just freeze my eggs, but there's no guarantee that those eggs will be
Yes. So
viable or,
there's absolutely no guarantee.
yeah.
What I always educate my patients on is your eggs are as healthy as your body, right? So if you know you're going to freeze your eggs, maybe start working towards getting your body as healthy as possible.
Mm,
So look at things, the foods that you're eating, right? Are those healthy foods? I mean, almost everybody and their mother have heard, unless you're living under a rock, that you need to be eating vegetables and fruits and whole grains and fiber and berries, because those things have what is called antioxidants. Antioxidants help to repair oxidative damage in mitochondria. Those are the nuclear powerhouse of eggs. They help to repair damage in the eggs, right? So if you can consume healthy antioxidants, in some cases, you might need to go on vitamins that have CoQ10, which is another antioxidant. And then check your habits. Are you smoking? If you're smoking, you're doing damage to your DNA. Um, are you consuming excess alcohol? And we now know, there's a lot of studies coming out that marijuana can have damage. So, ever since marijuana was legalized, a lot of people are using it.
Oh,
And
fun.
now we are having studies coming out showing that there may be some damage to the DNA,
Mm,
especially also in sperm and maybe in eggs as well, decrease their quality, decrease sperm morphology. So you're doing all this damage to your gametes
yeah,
before you even plan on freezing them, right?
yeah.
And then people need to be careful about what kind of makeup they use. Not all makeup is healthy. You can research which one is healthy or not. I think there's a website called Skin Deep that tells you which ones are really toxic.
Mm,
Are you using all these foods that are highly processed and have, coloring agents in them, like, Agent Red or whatever that's being claimed to be a carcinogen? Um, are you imbibing a mostly sugar diet? So these are things that are not just, they're not healthy for your body, but they also, in particular, are not healthy for your eggs,
mm.
right? So your lifestyle, are you getting enough sleep? Are you trying to eliminate stress from your system as much as you can? So a lot can be done before you even get to freezing your eggs.
That's great. Yeah, I'm glad you bring up nutrition. Nutrition is so important
Yeah.
in every aspect of our life, in every phase of our life. And definitely, watching what we're eating, making sure that it's as clean as we can get it, and really being, mindful about our whole body, right? Not just our eggs, but realizing that the food that we take, the activities that we participate in really affect our the sperm and the egg quality. I think those are all very important information because it's not something that people often think about, right?
No.
So I think
I,
it's really
yeah.
important that you bring that
Yeah.
up.
Yeah. And in my case, I have patients, a lot of patients from Asia and Africa. And sometimes I'll sit down with them and look at some of the traditional meals that they like, right? You're not going to have someone change their entire palate. They won't follow your advice. So let's look at what's in your cultural food that's delicious and healthy, because some of it is really, some of those home cooked meals are really delicious and really healthy, and
Right.
helping them explore that, giving them examples of what will be really healthy within their cultural palate.
Hmm. That's fantastic. I am glad that you do that, being as close to, like you said, right? Anyone that starts a new diet knows this, that if it's not in line with whatever you're used to eating, or
Yeah,
especially I know, like, there are people that are diabetic. And if you're Southeast Asian, then, rice ends up being a staple in your diet, but that's not really helping your diabetes, right?
absolutely.
So really important to take a look at what we're eating and how it's contributing to our overall health. So I think that's really super important. So circling back now, let's, about aging and intimacy and fertility. What are some recommendations that you would offer to patients that are perhaps in their 40s, late 30s, early 40s, trying to get pregnant, and, they see that their intimacy is just falling by the wayside? Are there any suggestions that you have that could perhaps help increase their intimacy and also maybe increase their chances at fertility?
So, in that case, what I like to do is work side by side with a therapist that can help them. When I say side by side, I may say, okay, we can start some preliminary fertility workup, but I also want you to start seeing a therapist so that, they're working on the emotional side
Yeah.
as I'm working on the medical side. And somewhere further down the road, we'll meet up. So as opposed to starting one first and then going to the other, I encourage them to do things that can bring relaxation to both of them. One of the things I say is find something that relaxes you that you can do together, right? And
Mm,
that may be going for evening walks together.
yeah.
That may be going for massage therapy together, or doing a yoga class. The whole point is to have you both doing this lock and step as you work with a therapist while we're going ahead with the fertility workup as well.
Yeah, I think that's a very good point that you bring up because what sometimes can happen is that the couple ends up seeing each other only when they're trying to have sex, right? Or
No,
only when they're trying to be
that's
intimate.
not going to work.
And correct. And that's not going to work because that's going to cause actually even more strife and more
Exactly.
strain on that relationship because the only time that they're seeing each other is when they're trying to conceive. And outside of that, they're not even seeing each other. So I like the
Exactly.
fact that you are trying to incorporate, activities that they do together outside of the bedroom. So they're building
Yes.
that emotional intimacy. They're allowing themselves to become vulnerable with each other and they're forming a connection outside
Yes.
of that bedroom, which is really going to be what helps to maintain that relationship as
Yes.
opposed to just seeing each other as, a biological, as utility
Sperm.
for right their reproduction, right? That's the only reason that they see the other person. And that reminds me that actually, sir, it takes me back to that story, right? That you started off the podcast with two people living in two different countries and only coming together when they want to have a child, which says so much about their relationship, but also, is to me a huge red flag that they are not able to even be in the same country. And, I'm really curious on what that relationship would even look like.
Yeah, that's going to be my biggest challenge in my career
Yeah, I can
if
imagine.
I could sort that conundrum out,
Yeah.
because we just have such a huge gap in relationship that I don't even know where to start helping them, right?
Yeah.
That's going to be a challenge. Stay tuned.
Yeah, I'd love I'd love to know what happens, right? That'd be really interesting. But yeah, I mean, I think to really focus that couple's energy on things outside of the bedroom would really be something that would help encourage that relationship and help to build stronger bonds, right? And I think that during this time when it's already emotional to begin with and then stressful because they want to have that child, anything that helps to build more bridges together as opposed to burning those bridges, I think, would be really helpful.
Absolutely.
Yeah.
Absolutely.
Yeah. So, well, for those listeners out there that may be listening to you and saying, wow, I'd love for her to help me conceive and how can I get in touch with you? So, how can they get in touch with you? How can they find out
So
more
we
about
are at montgomeryfertilitycenter.com,
Okay.
or they can email us directly at FAQ, that's frequently asked questions, FAQMFC@gmail.com.
Mhm.
And they can follow us on all our social media handles and look up Fertile Talks anywhere they get their podcast, on Apple Podcasts, Spotify, Amazon,
That's
iHeart,
fantastic.
we're there.
Oh, excellent. Excellent. So, any last pearls that you would, or pearl that you'd want to leave somebody with who is really trying to navigate, that interplay between aging and intimacy and their fertility and what to do? Any, pearls that you think would be really
What
important?
I would leave them with is your relationship matters.
Yeah.
Your relationship is the foundation and extremely crucial. So if you don't have that foundational relationship, it's really hard to put anything on top of that. So if you're having issues with your relationship, you need to seek out help. You need to get a therapist. You need to get on board with someone who can help both of you.
Yeah, I think that is fantastic. I think that is great advice. And I think that is something that is super, super important to realizing and understanding that intimacy begins outside of the bedroom and
Yes.
really important that when you are trying to conceive and you have all these stressors on that your relationship should be as solid as it can be, right? And we know that it's hard during a stressful time, but as strong as it can be, because then it can weather the storms of not only just conceiving but then after that, right? Like what happens after that? Once you conceive and you're an older patient, then you are a high risk pregnancy. Then what happens with all these high risk pregnancies, and how you need to be followed and this and that. And then even the harder part, right, is taking care of the child for the rest of your life. So a
Absolutely.
lot of important tips. So, well, thank you so, so much for coming on. And, I'm sure the listeners learned so much from you, and as did I. And we really appreciate your time. And Well, I am done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So if you have any questions about your fertility, definitely go speak with a reproductive endocrinologist that can help you out. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.